My name is Jennifer Anderson, and I'm the Executive Director of Breast Cancer Solutions. You may know a little or a lot about Breast Cancer Solutions and what we do and how we do it and why we do what we do. But perhaps what you didn't know is that for many years, we have offered a Speakers Bureau type program called Speaking of Solutions. During normal times, we take our presentation out on the road and we speak to community groups and church groups, networking groups, you name it, about breast cancer and breast health, what we do as an organization, and more. But we know we can't do that right now, so what we've decided to do is bring Speaking of Solutions to you online. This ongoing educational series will cover a range of different topics related to breast health and breast cancer. For our first episode, you're going to hear from two of our current board members. First, Dr. Edward Nelson will speak to you about advancements in breast cancer treatment. Then Dr. Diana Lithgow will talk to you about the impact of the coronavirus on breast health and breast cancer services and what's going on in the community as a result of the pandemic. We hope that you enjoy our first episode of Online Speaking of Solutions, and we look forward to hearing your feedback about what you would like to see in future episodes. So sit back and relax and enjoy the first episode of Speaking of Solutions.
I'm Dr. Edward Nelson. I am Chief of the Division of Hematology Oncology at the University of California, Irvine, and a board member of Breast Cancer Solutions. We know that we have seen tremendous progress over decades in the survival of patients with breast cancer. A large part of that is due to better screening, but a substantial part of it is to better therapeutics, such as the development of anthracyclines in the 1980s, the development of taxanes in the early 1990s, the development of advanced hormonal therapies in the early 2000s. We have also noticed that this trend of increasing therapeutics has continued even to today with the development of molecularly targeted therapeutics. Those are therapies that are specifically targeted to biological pathways that are important for driving a tumor's growth. If we look at the development of cancer therapeutics in the long term, we can trace them back to the early 1940s. And at that time, we essentially had surgery. That was it. In the next decade or so, we had development of chemotherapeutic agents, which we still use today, anti-metabolites such as methotrexate and 5-FU, cyclophosphamide or Cytoxan, and the development of radiation therapy. We also had, in the next decade after that, the development of combinations of chemotherapy agents. In the 1970s, there's a bit of a lull. There's not a whole lot that comes online. But then in and around the 1980s and into the 1990s, there is the development of advances in supportive care, that is, growth factors to help our bone marrow come back faster, better anti-nausea medicines, so forth and so on. It was in the early 2000s that we had the development of these molecularly targeted therapeutics. And from the outset, from 1940 to 2008, there were a total of 13 FDA-approved molecularly targeted therapeutics. If we look at the next decade, that would be 2008 to 2018, we see a continuation of the acceleration in the development of molecularly targeted therapeutics, such that there were 76 FDA-approved molecularly targeted therapeutics in this decade. If we now look at the next 2.5 years, from 2018 to the third quarter of 2020, this accelerated. And indeed, in that 2.5-year period, we had 48 FDA-approved molecularly targeted therapeutics. The next graph shows you the acceleration, the logarithmic growth in the development of molecularly targeted therapeutics, and provides a reason why practicing medical oncologists have to stay up to date and have to understand the rapidly evolving complex of therapies offered for all of our patients, but breast cancer patients in particular. We expect that with these molecularly targeted therapeutics, we will see a dramatic improvement in the survival of patients with breast cancer.
Hello, my name is Diana Lithgow. I am the current president of Breast Cancer Solutions. I am following in the footsteps of visionaries before me who saw the need to support women in financial distress during their breast cancer treatments. I'm a family nurse practitioner, 34 years. I see women's health, and a large percentage of my care is in breast cancer. I have family members, 2 aunts, 2 cousins, and a sister who are breast cancer survivors, and many friends, just like many of you. I got my PhD looking at breast cancer biomarkers in my clinical research, trying to find something that told us breast cancer was happening and changes were occurring in the breast before actual cancer came, much like we have for the PAP for cervical cancer. But we're not there yet. We don't have that tool yet. We're still working on it. Well, in my professional practice, my personal life, and my research work, we have breast cancer as a recurring theme for me, and therefore Breast Cancer Solutions is near and dear to my heart. Until we have a breast cancer biomarker or predictive test and better treatment, we need to help women who are undergoing breast cancer treatments. They're in difficult times. They need resources and they need financial support so they can go on living long and healthy lives. That's where we come in. Without Breast Cancer Solutions, many of these women would have to choose between their treatments or paying the rent, or paying their bills, or taking care of their families while they were sick. No woman should have to make that choice. That's why we're here. That's why we're here. Now, at this very surreal time in our country, with this COVID-19 virus, they're not getting their mammograms. They're not going into facilities because they're afraid. They're foregoing their preventive health care. Yet cancer is not taking a vacation or a staycation. Their cancers are still growing inside them. They're advancing. And soon we're going to see a bloom of cancer, breast cancers, in more advanced stages than they were before, requiring more difficult, advanced, and aggressive treatments.
Thank you so much, Dr. Nelson and Dr. Lithgow, for your very informative discussions about what is going on with breast health services in the community right now and the latest advancements in breast cancer treatment. We do look forward to bringing you more episodes of Speaking of Solutions in the coming months. In the meantime, please feel free to comment and give us some feedback on topics you might like to see down the road. In the meantime, please make sure that you are getting your mammogram every year and continue to be an advocate for your own health care. We'll see you next time on Speaking of Solutions.